Obesity has been linked to many serious health conditions, including diabetes, heart disease, and cancer. A small but rapidly growing number of U.S. adolescents began treatment with Novo Nordisk's weight loss drug Wegovy last year, a powerful new tool to address record rates of pediatric obesity, according to data shared exclusively with Reuters. In the first 10 months of 2023, 1,268 children ages 12 to 17 with an obesity diagnosis started taking Wegovy, according to U.S. insurance claims data compiled by health technology company Komodo Health. In 2022, only 25 children were prescribed the drug, which did not receive U.S. approval for adolescent use until December of that year. A month later, the influential American Academy of Pediatrics recommended weight loss drugs be offered to children with obesity starting at age 12. Medicaid data obtained by Reuters from 5 states, including Michigan, Minnesota, and Wisconsin, show a similar uptick in use of Wegovy. The overall numbers remain small, with at least 464 children across the 5 states being prescribed the drug since January 2022. That does not include prescriptions bought without health insurance or off-label. Use of 2 similar treatments for type 2 diabetes, Ozempic from Novo and Mounjaro from Eli Lilly. Even so, they are a drop in the bucket, as nearly 20% of U.S. children, or about 14.7 million, have obesity, according to federal estimates. But the data indicate an increasing willingness among families to embrace Wegovy, the first highly effective treatment for obesity short of surgery. Use of the weekly injection can involve great cost, with limited data on long-term risks and benefits. I use these medications wherever I can. Unlike with adults, where it's like a rescue operation, we are much more likely with children and adolescents to prevent disease, said Dr. Suzanne Cuda, medical director of Alamo City Healthy Kids and Families in San Antonio, Texas. Cuda was an advisor to Novo Nordisk on pediatric obesity. Obesity has been linked to many serious health conditions, including diabetes, heart disease, and cancer. Komodo reviewed health insurance claims involving nearly 20 million children, or about 80% of the U.S. population aged 12 to 17. Among these patients, 2.25 million adolescents had an obesity diagnosis listed in their insurance claims during the nearly 6-year period reviewed. The analysis was conducted using closed insurance claims through October 2023. Some medical experts urge caution given a lack of evidence about how these medications may affect development. The U.S. Preventive Services Task Force recommended intensive counseling, including behavioral therapy and nutritional education, rather than medication, for helping children who need to lose weight. We don't really know what these medications do in the context of the growing child, said Dr. Dan Cooper, Distinguished Professor of Pediatrics at the University of California at Irvine.